Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Glaucoma. Glaucoma is a group of diseases which are characterized by progressive form of optic nerve damage. In glaucoma, there is raised intracranial tension is seen. The chief therapeutic measure of this glaucoma is to decrease the intracranial tension either by reducing the secretion of aqueous humor or by increasing the drainage of the aqueous humor. Major amount of aqueous humor, that is 90%, will drain by the trabecular route, whereas 10% will passes through the connective tissue within the ciliary muscles, what is called as uveoscleral outflow. In uveoscleral outflow, the 10% of fluid will pass into the connective tissue spaces within the ciliary muscles and then via the suprachoroidal into the episcleral vessels. There are two types of glaucoma is present. We have open angle glaucoma, we have open angle or wide angle glaucoma is present. Then we have closure, that is angle closure glaucoma is present. So open angle glaucoma is seen in genetically predisposed degenerative disease. So this open angle glaucoma is affecting the patency of the trabecular meshwork mainly. So here there is intraocular tension increases insidiously. So we should give ocular hypotensive drugs should be given on a long-term basis. Whereas in angle closure glaucoma, it occurs in those individuals with narrow iridocorneal angle with short anterior chamber. So in this angle closure glaucoma, intraocular tension remains normal until the attack is precipitated by mydriasis. Sometimes intraocular tension rises very rapidly, presenting as an emergency condition as acute angle closure glaucoma or acute congestive glaucoma. So the drugs for each of them will differ.
thank you and thank you for watching.